Good afternoon, everyone. I'm Jonathan Edelheit, President of the Healthcare Reform Center and Policy Institute and the Editor-in-Chief of the Healthcare Reform magazine. I'm excited to have everyone on the call today. We're really covering some, I think very timely and, important news, which is the employer mandate delay under the healthcare reform law. And I have my co-panelist today is Jennifer Kraft, an attorney with Seyfarth Shaw. She is a top national healthcare reform expert, and she consults and works with attorneys all over the country on advocating on their behalf with healthcare reform and advising them. I think the news, that came out just recently regarding the employer mandate being delayed has created a lot of issues with employers, with HR, with agents, asking the question, what does this really mean for employers? How do you plan for 2014, 2015? How do you plan for this year? Does it mean that you slow things down? Is this an opportunity to catch up and start really staying on top of healthcare reform and giving them a little bit more breathing room? So I think it has some really strong implications. And I think the most important thing regarding the employer mandate delay is that a lot of people have put their head in the sand in regards to healthcare reform. Agents deciding that they don't want to stay on top of the law, or that they just need to know the basics. HR professionals thinking that somehow their agent or an insurance company is going to educate them and tell them what they need to know. And I think the most important thing is knowing now is not the time to really stick your head in the sand even more and be even further behind the 8 ball. So with that, I would like to turn the presentation over to Jennifer Kraft.
Thank you very much, Jonathan, and good afternoon, everyone. The employer delay has certainly been a surprise, I think, for all of us that work in this area. I happened to be at a conference presenting last Tuesday, I guess it was just last Tuesday, when the news broke that the IRS had posted on a blog that they were going to delay the employer mandate, and there were former Treasury officials, former HHS officials there, and I think everyone was universally pretty surprised by this development. And so now the dust is settling a little bit, and we're figuring out what, as employers, need to really be doing now and still getting ready for the law. So we're just going to walk through that, kind of what's happened so far, what's been delayed, and really what you should be doing from an employer standpoint. Our disclaimer standard here and our brief overview for today. So first, talk about what's delayed. Secondly, we'll talk about what's not delayed, what still is going forward. Not all of the Affordable Care Act was uniformly delayed. And then finally, what employers should be doing now. The first piece, and kind of what is delayed, is basically two things: the employer mandate penalties and the employer reporting obligations related to those penalties. So the way this works is, as you all know, if you've been working on this area, the employer mandate applies to large employers if you have 50 or more full-time equivalent employees, and full-time for this purpose is currently defined as 30 hours per week on average. You add that number up with all your part-time employees and divide that by 120 to get kind of that second bullet there of your aggregated number, and you add those two together to get your full-time equivalent number. If that's 50 or more, then you are considered a large employer subject to the Affordable Care Act employer mandate, which means you need to either offer coverage to your full-time employees or be potentially subject to a penalty. The penalties, as you're probably, again, aware, if the employer has 50 or more full-time equivalent employees, the employer needs to offer affordable and minimum value coverage to at least 95% of its full-time employees. And again, full-time are those employees who are working 30 hours per week or 130 hours per month on average. And if you do not do that, then one of your employees goes to these new state-based exchanges that will be out there, a federal exchange, and purchases coverage and gets a federal subsidy. Then the employer would be assessed a penalty. And if you haven't met this 95% threshold, you're subject to kind of the big penalties, $2,000 times your number of full-time employees. As you'll note here on the bottom, small employers are not required to offer coverage. So if when you do that first slide, you do this slide and you are under 50, then you're not subject to this employer mandate, and this delay isn't really going to have as much of an impact on you either. If you are 50 or more, or you think you could be in the next few years, it's good to understand how these penalties work. The big penalty is that if you fail to offer coverage to at least 95% of your full-time employee workforce, it's $2,000 times the number of your full-time employees. And you can subtract out from that the first 30 employees. That's kind of the big penalty. If you offer coverage, but it's not considered minimum value or it's not considered affordable, then you have kind of what could potentially be a lesser penalty. This penalty depends on how many of your employees actually go to an exchange and purchase coverage and get a federal subsidy. If one of your full-time employees goes to an exchange, but you've offered coverage that just wasn't considered affordable or minimum value, the penalty in that case is $3,000 times just the number of full-time employees who actually go to the exchanges. So if you just have 2 employees who are full-time and go to the exchange in that scenario, you're talking about a $6,000 per year penalty as opposed to the big $2,000 per year penalty. The other piece that goes with this are these employer reporting obligations under the employer mandate portion of the Affordable Care Act. Employers are required to submit information to the IRS about whether or not they're offering qualifying coverage to their full-time employees. There are these new code sections, 6055 and 6056, that create these new reporting requirements where the employer needs to report to the IRS, and employer also needs to report to their full-time employees about whether they're offering qualifying coverage that would meet this minimum value and affordability test. The issue with this delay has really come up surrounding these reporting obligations. They're all new reporting obligations, and as you may know, we're in the middle of July now, and we still haven't gotten guidance from IRS on how that reporting is going to work. And those reporting obligations are key for the exchanges, the marketplaces, to know whether an individual is eligible for a subsidy, because the only way an employee is eligible for a subsidy on the exchange is if they're not eligible for minimum value affordable health care coverage from their employer. So the only way for the marketplace or exchange to know that is to know what the employer has reported into them. And those are the rules that we're waiting for. So on July 2nd, we first got wind of this delay through an IRS Treasury official blog post where he announced that the IRS intended to delay both the employer reporting requirements that the IRS was going to use to help determine these employer mandate penalties, so the reporting obligation into the IRS, as well as the reporting obligation to the individual employees themselves. And they also are going to delay, also said they would delay employer mandate penalties. And the reason being there that they're not going to have this reporting mechanism in place where they're getting this information from the IRS, so it's going to be more difficult to figure out what the penalties are going to be. So their idea is they're going to issue guidance this summer regarding these reporting requirements. So employers will have a full year to digest those new reporting rules, get used to them, get them into the works, and then employers will, hopefully have that reporting system all up and running next year for the employer mandate penalties to go into effect on January 1st, 2015 instead of January 1st, 2014. That is the big delay portion of it. The IRS did follow up on July 9th with official written guidance other than just a blog post. And for those of you that have been following healthcare reform, you know that it's been very unusual how we've been getting our guidance in this area. We're used to, in the benefits arena, having proposed regs issued and then time for comment and then final regs. And with the speed of this law going into effect, we've had a lot of guidance through very unconventional means. FAQs posted to the Department of Labor's website, and now, blog posts, IRS blog posts of talking about this delay. But they did back it up with official guidance. We had hoped that this guidance would give a little bit more detail on exactly how the delay was going to work. But the guidance is very brief, just a few pages, and it does confirm that the reporting obligations are delayed, as well as the penalties will not be in effect in 2014 at all. It also encourages employers to start voluntarily complying with those reporting requirements once the rules are issued on those. So as we get those rules out, they want employers to get things rolling with that so that they are ready to go when the employer mandate piece goes into effect in 2015. But it did leave a number of unanswered questions. That, you know, a lot of the proposed regulations that we've received so far have included different types of transition relief and transition periods for certain situations, like employers that are contributing to multi-employer plans. There was some question about how does the 90-day wait period work in a multi-employer plan where you as an employer may not have much control over the eligibility provisions of a multi-employer plan. And the IRS had said, that's okay, we're going to give you an extension of time. You can just, as long as you're following the multi-employer plan rules for now, that will be okay. For dependent coverage, the proposed regulation said, okay, employers, you don't actually have to offer dependent coverage in 2014. You just need to be making steps to move towards it, and eventually you're going to, in 2015, you'll be needing to offer dependent coverage. There's also transition relief in the proposed regulations about employers with off-calendar year plans, that basically if you had a plan that starts on July 1st instead of January 1st, and that plan covered a significant enough portion of your workforce, then the Affordable Care Act mandates and penalties would not kick in for you until that July 1st date. And lastly, the proposed regs had a provision about the variable hour employees and temporary employees definition, that you could, if when you hired somebody, if you didn't think they were going to work on average 30 hours per week for the whole year because you knew they weren't going to be there the whole year, you could factor in kind of that tenure of their employment in figuring out whether they really were a variable hour employee. That relief was only for 2014. So with all of these things, you know, they were really trying to give employers a little bit more time. And I think a number of employers, a number of our clients, I know, were looking at those as real assistance for them in relying on those transition periods. Now that everything's been bumped back as far as the employer mandate penalties till 2014, it's not clear whether there's going to be any additional relief, if they're going to bump these relief periods out a little bit further, or if everything's going to need to be up and running and ready to go on January 1st, 2015. The one thing we have heard informally from the IRS is that they had not made a decision on that piece as of yet, but that each of these transition rules that were in place were put into place with a specific reasoning in mind, trying to give employers a little bit additional time to get ready. So with that in mind, it seems that since they're giving employers, you know, everybody gets a full year to 2015, that some of these transition periods may not be extended. And so even employers with off-calendar year plans may need to be ready to go on January 1st, 2015. And it remains to be seen how the IRS will do that. One of the other things that the IRS issued, or actually HHS, the Department of Health and Human Services, issued regulations last week that said, okay, since the IRS isn't going to have this reporting from employers about whether they're offering coverage that's qualifying under these regulations, that employees can just attest about their enrollment in their employer's plan. They can say, nope, I'm not enrolled in any employer plan, or yes, I am, and sign it, and the exchanges are going to just rely on that employee verification. So it remains to be seen how exactly that will work. It would certainly work better with a check and balance situation where the employers, once the employers are actually reporting that information in themselves. So what's not delayed? The Affordable Care Act did not get a blanket pass till 2015. There are a number of provisions that go into effect in 2014 that are unrelated to the employer mandate. I think of these as kind of two separate sets of rules. One is related to the employer mandate and what employers need to do to avoid penalties for not offering coverage. And then the second is related to plans, and that applies to insurance plans, it applies to employer-sponsored plans. There are certain requirements that plans need to meet under the Affordable Care Act, and those plan requirements are not delayed at all. So starting in 2014, there's going to be cost-sharing limitations on small plans. Small and individual plans can't have deductibles in excess of $1,200 for an individual, $1,400 for a family. Those rules go into effect in 2014. Self-funded and large plans have out-of-pocket maximum limits as well, starting in 2014, and those sync up with the HSA contributions, high deductible health plan out-of-pocket maximum. So for this year, there's $6,050 for individuals, $12,100 for family. So that's going to be the maximum out-of-pocket for a self-funded or large group plan. So these are kind of design issues that employers need to be looking at their plans and making sure they meet these requirements in 2014. Also, plans starting in 2014 may not have waiting periods any longer than 90 days. So that's another design feature to be looking at these. The no pre-existing condition exclusions, you might remember one of the provisions that's already gone into effect for the Affordable Care Act is you can no longer, a health plan can no longer have any pre-existing condition exclusions for children under 19. Starting in 2014, that goes away for all individuals, adults and children, so no pre-existing condition exclusions at all, as well as coverage for approved clinical trials. One of the provisions that applies to non-grandfathered plans is that there are certain coverage requirements related to clinical trials and the co-pays and treatments around those. And those are going into effect in 2014 as well. So there's a number of provisions, kind of these plan design provisions that need to go into effect that you should be looking out for as you move into 2015 or 2014, regardless of the employer mandate delay. And so really, what should employers be doing right now? I think that the key thing is making sure you're meeting your ACA 2014 requirements that we just talked about. The second thing is really watching for this reporting requirement guidance. Now, there's definitely been, the delay is in place, and actually the House of Representatives is currently considering two bills, one which would codify the employer mandate delay, and another one which would put a delay on the individual mandate as well. So we'll be watching that to see if those delays do in fact go through. But once that reporting requirement guidance comes out from the IRS, employers should start looking at that and getting systems in place to have that reporting ready. I think the fact that we've had the IRS give us an extra year means that they may not be as patient with any additional extensions, and they really, I think, are going to be expecting employers to be ready to go and hit the ground running on January 1st, 2015. Another issue, the third issue here that is still in play is the non-discrimination requirements. Now, as you may recall, the Affordable Care Act imposes new non-discrimination requirements on fully insured plans, which state that you can't discriminate in favor of highly compensated individuals if it's a non-grandfathered plan. So historically, employers may have set up a management-only fully insured plan and maybe paid all premiums for that individual, maybe not had any coverage for everyone else. These non-discrimination rules were not delayed with the employer mandate delay. They previously, the IRS had said, look, we're not going to enforce those non-discrimination rules until we give you guidance on what exactly the rules are and how to work within them. But for employers that are trying to decide their design for 2015, it's good to keep that non-discrimination element in mind, because that eventually we are going to get those rules and they will apply to plans that are not grandfathered. And then finally, getting ready for the 2015 employer mandate. I know I've been talking to a number of employers that were counting their hours for their individual employees, trying to work some of the averaging out, figuring out if, number one, if they were subject to the mandate, number two, if so, which employees did they need to offer coverage. And those issues are all still in play, except now we have a little bit more time as employers to be able to document that and to be able to be a little bit more reflective about, tracking those types of hours. A lot of employers didn't necessarily have that type of tracking system in place. And now we have enough notice that we can get those systems into place. The downside to that is, since we do have more notice, IRS is probably going to be expecting a lot more of employers as far as knowing exactly who their full-time employees are and being ready to offer coverage to those individuals starting in 2015 or be subject to the penalties. I'm going to turn it back over to Jonathan, and then I can take a few questions at the end.
Thank you, Jennifer. One question I have for you, Jennifer, is what do you think of the school of thought of some people who maybe didn't stay on top of healthcare reform before and now are saying, well, this is an excuse for me not to become educated on it now because maybe it'll all go away?
Yeah, it's a great question, and quite frankly, I've been dealing with that question since the law was enacted. There's been we've got the Supreme Court challenge, and then we have another election, and then another election, and it keeps going forward. And so I find the employers who are really in the best position are those that are, you can hope for the best but plan for the worst. Really being able to know how this is going to impact your business. It's best to really not stick your head in the sand and be fully aware of how the law would impact you, how you would calculate your employees. I think the extra time is helpful in that one of the challenges I think a number of employers were having was that they hadn't really been tracking their employees' hours and considering them in this kind of context of do we offer coverage or not. And so this gives employers an additional breathing room to do that. But I think, most employers that were struggling with this were really looking at having enough time to do that. So this extension just gives them that time.
Yeah, and I think it's, one thing that's important that a lot of people don't think about when they think that, the healthcare reform law might disappear is if you look at all the groups that actually lobbied for it, you had, the health insurance companies, you even had the AMA, you had medical supply, medical equipment, pharmaceutical companies, and even the health insurance agent associations for health insurance agents lobbied for it. So it's going to be very difficult to, there's not really that many organizations that are lobbying against it except some of the business organizations. Am I right with that, Jennifer?
Yeah, that's right. And what's interesting, I think, about the pending legislation, I mentioned the two bills that are pending, one on confirming the employer mandate delay, but one on the individual mandate delay. And I think that could be met with some resistance from the insurance companies because part of their idea of, okay, we'll remove lifetime limits and pre-existing conditions, but everybody needs to be in the pool. Everybody needs to have insurance to make that economically work without going into these death spirals that you've heard talk about. One of the other pieces of legislation that's pending that you've probably heard about is the idea to change the 30-hour per week requirement to a 40-hour per week requirement. And it remains to be seen whether those types of tweaks would pass through Congress. So far, we've gotten really no changes at all to the substance of the act. In fact, I was on a panel with someone who had worked in Washington for 20 years and said, it is so unusual to have not even a corrections bill, really, where you go through and clean up some of the ticky-tack definitions and things that happen from drafting legislation. And that's, I think, just a virtue of the fact of this being such a politically challenged bill in general that it's very difficult to get anything passed, let alone kind of major change.
And that was really a great point you made regarding adverse selection with the health insurers because they did fight for the law, and that was based upon the individual mandate. And if they delay that defeats the whole pre-X issue and creates a significant adverse selection. And obviously, they're probably going to be one of the biggest lobbyists fighting against that individual mandate being delayed. So I think it's, I understand the fighting against the employer mandate, but I think there's not going to be that many supporters fighting against the individual mandate. So we're going to go into questions and answers in just a minute. Just want to run through a couple quick slides for you. This is brought to you, this presentation, by the Healthcare Reform Center Policy Institute. One of the things, we have a lot of people that have been enrolling in around the country is the Certified Healthcare Reform Specialist. We've had a lot of success. It's available online or in person. We did a live training for the San Diego Association of Health Underwriters about 2 months ago. We're doing one next week in Los Angeles for those who really want to learn it live, and going to be rolling that in different parts of the country. And then that's also going to be available at our annual conference. And for those people on our webcast, we always offer a special, and the certification is $995, and attendance at our conference is $895. But if people get certified now online, they'll also get a complimentary pass, so they'll save about $895 on the certification and be able to come to our healthcare reform conference. Let's get through a couple of these slides of the benefits of healthcare reform so we can get to the good part. And I hope everyone stays tuned to more of our healthcare reform webcasts and updates, and hope you come out to the healthcare reform conference, which is November 3rd through the 5th, because we're really going to focus on really the cutting edge stuff. We have some of the top leaders in healthcare reform presenting. We have Phyllis Borzai from the Department of Labor, who's going to be a keynote speaker, who's really involved in a lot of the rules and regulations of what's happening, and the Deputy Commissioner for the IRS. So it's really where you're going to get all that last minute rules and regulations they're probably going to be pumping out in the next month or two that you need to comply with. And we do have a complimentary pass program for certain employers and brokers and agents where you can apply for a complimentary pass to the healthcare reform and the Employer Healthcare Benefits Congress, and you can go right to the website for that. So with that, we'll open it up to the questions and answers. And I know we had one question that I'd like to offer to Jennifer, and it said that the things that you talked about that are not delayed, that are still in force, do these apply January 1st of 14 or renewal date of 2014 or 15?
The general rule is for 2014 that the plans need to comply on January 1st, 2014 from kind of a plan design perspective. If it's a renewal policy, I suppose you may have an additional time for that piece of it, but from kind of the employer plan year sponsor, you're looking at from an employer perspective, you're looking at what the plan year is for the plan and what's reported on the 5500s and in your summary plan description is the plan year. So that you'd want to state. Okay.
We have another question from Therese that says, you know, if a group renews September 1st of 2013 and currently offers coverage to employees working 36 plus hours per week, and there are 45 employees currently eligible for coverage, and they have 45 employees working 30 to 36 hours per week, and I believe that's in addition to them, when does the employer need to offer the ones working more than 30 hours coverage? Would that be upon renewal September 1st of 2014 or January 1st of 2014?
Yeah, that's a great question. So you've got this group of employees who are 30 to 36 hours per week. The employer mandate piece has been delayed. Now, in the existing guidance, there was this exception for off-calendar plan years. If you offered a significant enough coverage to at least 25 to 30% of your employees before, and you were an off-calendar plan year, then you could have until the start of your plan year that started in 2014. We don't know if they're going to extend that same type of extension into 2015 as well. So that's part of the guidance that we're waiting for from the IRS. The transition relief that extended that off-calendar plan year came in the proposed regulations for the Affordable Care Act employer shared responsibility provision. So what will likely happen is we'll get final regulations that will spell that out, and they'll let us know if we do in fact have that additional time period. I think, again, hope for the best, plan for the worst. I think you kind of prepare for a September 1st, 2014 date for now, and then hopefully in that time period we'll know whether there's an additional extension for employers with off-calendar plan years.
Okay. Amy Dutton asked another question, but I think we kind of answered that, and that was, do you think they're going to increase full-time hours back up to 40? And I know you had said that it's very rare that they amend or make corrections to the law.
Yeah,
so
that's been one that's been getting a lot of press, and I think a lot of employers it would really help them a lot. I don't know how likely it is to get passed.
So we have another question that said, if an employer's plan is currently is not a minimum value plan, and they pay 50% and the employee pays 50%, when do they need to start offering that minimum value plan and charge no more than 9.5% for the employees?
It's a good question. Right now, it looks like 2015 is the soonest that you would have to be worried about whether your plan is affordable. I mean, in theory, if your plan is not affordable, then one of your employees could go to the exchanges now, or in 2014, and get coverage and get a subsidy because they don't have minimum value affordable coverage available from their employer. but the employer would not be subject to a penalty in 2014 due to this delay.
Another question we have is, what recommendation do you have for health plans that are domiciled in the state with exchanges as it relates to mandatory coverage items defined as essential health benefits? Do you sit and wait until the exchanges define the mandatory coverage items?
That's a good question, too. The essential health benefit analysis comes into play for two reasons. One, if there is a plan that's offered on the exchanges, it needs to offer coverage for all of the essential health benefits for the benchmark of that state. The other reason it comes into play is for employers. If you are an employer-sponsored plan, you can and have some control over the design of the plan. You're not allowed to have any annual or lifetime dollar limits on any essential health benefits. A self-insured plan, though, of an employer is not required to offer all of the essential health benefits. It's so that benchmark becomes important for what you can have dollar limits on, but not necessarily what you need to offer. Now, right now, CMS does have posted on their website I believe they have something for each of the states, at least as where they're tending to go for each of the states on essential health benefits, and I think you just monitor those. But as far as offering coverage, you'd want to make sure that, if you are on, buying coverage on an exchange, that it would offer all those essential health benefits, and it would, because that's how it gets to be offered on the exchange. Otherwise, you're really looking at it more for purposes of your annual dollar limits to make sure that you don't have any annual limits that would, dollar limits that would be on any of those essential health benefits.
Okay. We had a question from David that he was wondering if there was a typo in your PowerPoint when you talked about deductible maxes, and that he thought it was 2,000 and 4,000.
Oh, on the deductible limits?
Yes.
I may have misstated that. I don't know if those were in the slides or not. But you're right. The deductible limits that go into effect are just for small plans, small and fully insured plans.
Okay. David has asked, are you saying that large group plans must still meet the requirements for limits on out-of-pocket maximums in 2014? And if so, what is that limit?
The out-of-pocket, am I saying that, I'm sorry, could you repeat that, the out-of-pocket maximums for 2014?
Yeah, he's asking, are you saying that large group plans still are going to be required to meet those requirements for limits on out-of-pocket maximums starting in 2014?
Yes, they are, and those limits are $6,050 for individuals and $12,100 for families.
Okay. Patrick had a question that said, if a small group already offers coverage and plans on continuing to do so, are they required to disclose the value of insurance they provide on the employee's behalf to the IRS? And what specific reporting requirements are they responsible for? I know you kind of covered that before, that it hasn't.
Well, it's a good question because there's kind of two levels of reporting. This new reporting is a direct report into the IRS under Code Section 6055 and 6056. But there's also, and that's really telling the IRS, yes, we're offering qualifying coverage. There's then in place, however, the W requirement reporting for larger employers, where you have to include on the W-2 the value of the coverage as a non-taxable item, but something that you report on the W-2 itself. To the extent you are already subject to those W-2 requirements, those still continue to apply. But the new reporting requirements where you give the IRS information about whether it's qualifying coverage, that's been delayed until we get additional guidance from the IRS.
Okay. We have two questions on the PCORI fee. One asked, has that been delayed, or is it still due July 31st?
Fortunately, that one's still due July 31st. It has not been delayed.
Okay. And then Jeffrey has asked a question, giving an example of the PCORI fees, if you could explain a little better. So if an employer's current plan year is March 1st 2013 through 2014, will they need to pay the fees starting July 31st, 2013 through the next July, or do they need to pay for the previous plan year going back into, it looks like 2012?
Yeah, I wanted to double check on that because I know there's a rule for the PCORI fee and then one for the transitional reinsurance program that's slightly different as far as based on when the plan year ends. So if that's when we can post the answer, I can just confirm that.
Okay, and Jamie asked if the deductible limits affect HRAs.
Yeah, HRAs have been under discussion, and the DOL's website has talked about how these annual limit rules are going to work with HRAs and kind of the standalone HRA versus an HRA that's integrated with a health plan itself. And the way the Department of Labor is going is those annual limits would apply to standalone HRAs so that they're a problem to have a standalone HRA. If all you have is an HRA where you give an actual dollar amount, it's going to be a problem under these new annual limit rules. The Department of Labor has said that they would give additional guidance on that, but that's where they are leaning based on their FAQ so far.
Okay. Teresa has said that Humana in the state of Florida advised her that they believe they can get a small group deductible higher than the 2,000, and that was the 2,000 was an estimate based on actuarial value. Is the 2,000 set in stone, or is there any kind of flexibility with that?
I don't think there's any kind of flexibility, but that's another one that I can confirm and we can post later as well.
Okay. I know that's all the time we really have for the questions now. This webcast is going to be available in video form. We're going to email it to everyone in the next 48 hours. You can watch it again and see the slides and listen to the presentation. Also, if you have any questions that weren't answered or that you'd like to ask, please post it on our Healthcare Reform LinkedIn group. We'll be using that so that when we, answer the questions, we can kind of make it available to everyone. Or you can email either myself or Jennifer Kraft. Her email address is on there, and hopefully we'll see you at the conference that's coming up in November. So I'd like to thank everyone for coming on, and thank you, Jennifer.
Thank you. Have a good day.
Everyone, take care.